Hello, my name is Courtney Spees. I'm doing the case study on chronic kidney disease for Mr. Stinson. He's a 2-year-old male. So the first thing that I would do is walk into the room and do my QSIN. So I'm looking to see what position the patient's in, how many side rails they have up, whether or not the bed is lowered all the way to the floor, if the wheels are locked, what position he's in, and then I'd be looking for any like catheters, drains, tubes, IVs, oxygen. I'd be looking at if his surroundings were clear, nothing's in his way to the bathroom or any exits, and that his bedside table was in reach and his call light's in reach. I'm also making sure that his whiteboard is updated correctly with the correct providers. So the first thing that we're going to do is walk in, introduce ourselves. So hi, my name is Courtney. I'll be your nurse today. Can you give me your name and birth date, please? All right, and so he answered that question correctly. And so what I'm going to do is just go ahead and check that to his ID bracelet, and then match his ID bracelet to his chart before I start any assessments or anything. So I'm actually going to start with his assessment. Alright, so like I said, I'm going to ask his name and date of birth. I'm going to ask him if he knows today's date. I'm going to ask him if he knows where he is and then why he's here. His name and birth date, obviously. Then the next thing I'm going to do is go ahead and take my pen light and do Perla. Okay, so 3 millimeters. I'm going to go ahead and have him turn his head to the right side and to the left side. No JVD noted. I'm going to go ahead and look at his skin real quick. It's pale, warm, and he's a little diaphoretic. The next thing I'm going to do is assess his pulses bilaterally. They are present but irregular, so I'd sit here and count for an entire minute. I'm going to go ahead and do cap refill on each finger, less than 3 seconds. I'm going to have him wiggle his fingers. I'm going to have him do grips for me. Okay, those are moderate and equal, and then push me and pull me. So he's able to do all those things as well. He's complaining that his skin is itching severely. So I'm just going to go ahead and chart that into the chart and let the doctor know. The next thing I'm going to do is perform a respiratory assessment. Have you had a cough lately? No? Okay. So he came in complaining of some shortness of breath. Okay, so his respirations are a little rapid and labored. Like I said, he's complaining of that shortness of breath. So I'm going to assist him to sit up on the side of the bed. I'm going to listen to the back. Okay, I'm going to listen. I'm going to see his ventilatory depth. Okay, so I heard some crackles noted bilaterally, anteriorly, and posteriorly. So we're going to go ahead and chart that. So the next thing I'm going to do is abdominal assessment. So the first thing I'm doing is inspecting his abdomen area. So I'm not seeing any like open wounds, any bruises, cuts, anything like that. So the next thing I'm going to do is auscultate his abdomen. Okay, and then he said that it was non-tender and his abdomen was round and soft. Bowel sounds times 4 quadrants. I'm going to go ahead and palpate now. He's been complaining of some diarrhea and nausea. nausea, so I'm going to go ahead and chart that as well. Nope, I'm going to ask him if he's had any painful urination or discharge. He says no. Okay, so now I'm going to go ahead and move down. Are you having any pain, paresthesia, any paralysis, any numbness, tingling in any of your extremities? He says no. So for right now, I can go ahead and tell you he has +2 pitting edema on his lower extremities bilaterally. So I'm going to make sure that I'm going to first ask him if he can wiggle his toes for me. Okay, and then I'm going to check his cap refill on each toe. Less than 3 seconds, but barely cutting it. We're going to go ahead and check his pedal pulses. So those are present, but they're bounding. I'm going to go ahead and have him push me and pull me. And then I like to just take my pen light and rub it on the bottom of their feet, making sure they can feel me. I think that is about it. Yes, ma'am. That's it for that. Okay, so the next thing that we're gonna do is I would go ahead and take his vitals, which those were 98.6, 102, 24 respirations, 153 over 97, and 90% on 90% for his stats, and he's rating his pain a 4 out of 10, or 4 from a 0 out of 10. So he's pretty lethargic, but he's still able to answer my questions. Just needs some, just have to ask them a couple of times, but that's okay. So what we're going to do is, like I said, obtain a weight, and then get his vitals. So what we're going to do as well is look at his lab results. So his lab results, his BUN was high, his sodium was a little bit low, his creatinine is high, his calcium is low, his CFR is low, his phosphorus is high, and his potassium is high. So his BUN and creatinine and GFR is going towards that he's in kidney failure, and they aren't filtering the blood waste that's building up. His electrolyte imbalances are pointing towards kidney disease and acidosis. Metabolic acidosis is suspected because his kidneys aren't able to retain the bicarb, and this may be contributing to the hyperkalemia. The BNP is elevated, which means fluid volume overload, so kidney failure is not going to his dialysis, heart failure, and anemia due to lack of erythropoietin. So since he didn't go to dialysis, his kidneys aren't functioning properly, which means that's why he needs the dialysis. So he probably felt sick because of his low potassium levels and azotemia, and since he misses dialysis, this caused him to go into fluid volume overload also. So since he didn't go to dialysis, this really caused a lot of problems and sent him in a direction that we did not want him to go. So they're wanting us to get a bed for him at the hemodialysis unit. Before he goes, I would make sure to hold any meds that might be dialyzed off. I'm going to assess his vital signs. I'm going to obtain a weight for his baseline. I'm going to assess the heart and lung sounds again, and then assess the skin and edema and make sure I'm going to chart all that. So he went ahead and went to dialysis. They pulled off 3 liters. And I'm going to administer some erythropoietin, 2,000 units sub-Q. So I'm going to go ahead and do that. So with erythropoietin or Epigen, it's used for anemia due to decreased production of erythropoietin in end-stage renal disease. So I'm going to go ahead and give him some patient education. I'm going to tell him like what's going on and why the doctor's ordering it. So we're going to go ahead and give this to you because you're anemic. We're going to make sure that we're going to monitor you closely because we're supposed to be cautious when using this in the elderly due to increased risk of thrombosis. I'm going to go ahead and before I give this, check his hematocrit in his lab work. While I'm preparing this med, I'm not going to shake the vial. Shaking may inactivate the glycoprotein. I'm going to discard anything I don't use. I'm going to make sure that he understands that his pelvic and limb pain should dissipate after 12 hours. I'm also going to tell him if he feels like anything is wrong or he feels dizzy, weak, anything like that to let me know. And I'm going to reassess him after 30 minutes anyways. So I'm going to go ahead and I did the patient I reassessed his vitals and then I've done his patient teaching. On the use, the side effects, and the expected outcome. I'm going to go ahead and verify his allergies with him, and then I'm going to go ahead and check the chart to make sure that the order is correct. So we're supposed to be giving 2,000 units. So I have my vial here. I'm going to wash my hands and put on some gloves. I'm going to make sure I do my med right. So right patient, right drug, right time, right route, right dose, right reason, and right response. Sorry, that's my cat running around. So I wash my hands. I have gloves on. So I'm going to alcohol prep pad this vial. And I'm going to carefully draw this up. So I'm going to pull air for how much I want. I want 2,000 units. Inject that air. Turn it upside down, pull. Alright, making sure that I'm not touching the plunger. So since this is, I don't have like a safety cap order, I'm just going to recap this needle carefully by scooping it. So now I have another alcohol prep pad. And since this is sub-Q, I'm going to look for some fatty areas on the body. Before I do this, I'm also going to check his name and date of birth and make sure he understands what we're doing. So I have his bracelet here. I'm going to scan his bracelet, scan the med, do all that fun junk. So where would you like this? We can either do your abdomen, 2 inches from your umbilicus, do the fat of your back, your anything like that. So we're going to do abdomen. Fine by me. So I'm going to go ahead and take the alcohol prep pad here. I'm going to find my site. I'm going to rub that in a circular motion. In, out. Rubbing. I'm rubbing a little hard too, to kind of desensitize the area. So I have gloves on when I'm doing this. I'm going to take that area. I'm going to pinch it. Okay, ready? 1, 2, 3. Jabbing and then injecting. Okay. And then I'd put this in the sharps, but we're just going to recap it because this is only what I have. Alrighty. So, I'm going to make sure that I am charting what route I gave it and then what side I used. So I used his left abdomen. I'm going to go ahead and put what I gave, how much of it I gave. So I gave 2,000 units. And then what time I gave it. So we're going to say at 9 in the morning. And then I'm going to come back and reassess patient, and then I'm also going to reassess the injection site, making sure that there's no like redness, swelling, pain, nothing like that. It's not itching. And I did that at 9:30, and I charted that as well, and I said patient tolerated well. And then the next thing that we're going to do is do some patient education on the importance of his hemodialysis and keeping his scheduled appointments. That way that he doesn't miss it, and then think, we don't want him to build up any waste in his blood, and we don't want him to have fluid overload. We also want to discuss nutrition, highlighting to avoid foods that are high in potassium, and then when to take his meds, and also explain what meds to take with or without meals. And then we're also going to make sure that he understands why it is important to report any of these signs and symptoms of like fluid overload, so like the +2 pitting edema, the bounding pulse, things like that to us before anything. And then when to call the doctor, when to know when to go into the hospital. So we want to express all those things. I'm pretty sure that is it with him. Yeah. So I'm going to go ahead and report off. So we have Mr. Stinson. He's a 52-year-old. He came in with a history of hypertension. He's a type 2 diabetic. He has chronic kidney disease, and he has congestive heart failure. And he came into the ED complaining of severe itching, nausea, and vomiting. He was pale and lethargic. He had shortness of breath, and he has crackles in his lungs. So we went ahead and assessed for fluid overload. I did his level of conscious and a neuro exam. I assessed his cardiac status, assessed for edema, did his vital signs, and I also assessed his dialysis site. We went ahead and ordered a CMP, a CBC, an ABG, and a BNP. His vitals, his heart rate was 102, his respirations were 24, his blood pressure was 153/97, and his oxygen was 90. His BUN was high, his sodium was a little bit low, his creatinine was high, calcium was low, CFR was low, phosphorus was high, and potassium was high. So we wanted to make sure that we gave him some Epigen since he was anemic. He was in fluid volume overload from his BMP results. We went ahead and before he went, we wanted to get him to the over to dialysis unit as fast as we could. So I made sure that I held his hypertension meds. I made sure that I held anything that might be dialyzed off. I went ahead and got a weight for him, and then so that's in the computer, and then I got another weight whenever he got back. We're wanting to make sure that we're watching his renal function panel and reassessing that. We're wanting to watch his labs. We're also wanting to monitor his weight. And then we're also wanting to make sure that he's not losing too much fluid, that dialysis isn't pulling off too much fluid too quickly. We don't want to make him go into shock or anything. So I gave 2,000 units of Epigen, a sub-Q injection only one time. So there's that. And then I provided education on importance of his hemodialysis and keeping his appointments. And then I also provided some education on nutrition and to avoid foods high in potassium. And then we discussed when to take his meds, and then whether or not they needed to be with or without meals. So yeah, that's about all that we did today. Fun times. Alrighty, thank you so much for watching.